So thank you for joining us today to learn a bit about some of the sites that may be participating in this coming residency cycle. Before we begin, we do encourage you to use the Q&A function for general questions. And if you have questions for sites, please feel free to use the chat function. You can direct message them during the course of today's event at any time. So just be mindful of selecting the site that you want to be connected with from the drop down in your chat. If you do have any questions, you can email us at events@aanmc.org for anything further. Next slide. So today is not for CE, it's just educational, and we will also be sending out a recording if you missed this or need to follow up with a little something afterwards. Next slide. So we'll be covering just a little bit of a timeline reminder, and then we'll jump right in to the site presentations. Next slide. Dr. Carino.
Hello. Just give me a second. For some reason, I've lost the page. So welcome, everyone. It's good to see you. Hopefully, all of you participants are enrolled in the AANMC portal and are able to keep track of all of the specific timelines that are there. And it's summarized in these areas, phase 1 and phase 2. We're still in phase 1, and phase 1 might seem like a period where there's not a lot happening, but I encourage you at this time to spend the time to get to know the particular sites that may potentially be participating in the match. And so do your preceptorship. Go meet them, get everything set up, particularly when it comes to the faculty evaluations, transcripts, your CV, all of your documents, because when you hit phase 2 from January 30th to March 12th, that happens really fast, particularly from January 30th to February 26th. So keep that in mind when you're looking at phase 2, which happens just into the new year. It's not that much further into the future, so keep that in mind. And then you'll see there that there's an interview and match period. So during the interview, which starts on March 31st, you'll have an opportunity to meet with those potential sites and to make your decisions and to wow the sites that are here as well as elsewhere that may be interested in having you come on board. And then you will have an opportunity to submit your rank list, as will they, and then match day, that magical day is May 30th. So best of luck, everyone. Listen with attentive ears and open heart. I think you'll find these sites really exciting.
So here are the sites that we are going to have with us today. And we're going to be just going in order of the folks here. So we have Ames Institute first, and I think that we're waiting on them to come. So we will go on to the next one, which is Alpine Integrative Medicine.
Hello.
Thank you, Jashar.
You're welcome. Hey, everybody. Hopefully you can see me okay. I'm on my phone because I am managing my son's basketball tournaments a little bit this weekend too. But this is super important, and I wanted to make sure that I was here to share a little bit about our clinic and about this residency. First off, I would just say that, a residency is something that's incredibly important. There's a lot of distance between where a person graduates from medical school and the postgraduate training and work and experience that's necessary to really hit the ground running as a physician. And so I think any of these sites are excellent to take a look at. As far as our site goes, we are offering a 2-year residency. We're a clinic here in Redmond, Washington, founded by my partner in crime, Dr. Brooke A.Z. Rentz. We have a number of other physicians that work with us that have a number of subspecialties that you can read from the slides, but pretty much we situate ourselves in 2 ways. As a clinic, we first situate ourselves as a primary care clinic that focuses on personalized concierge medicine. So we have a hybrid billing model where we bill insurance and also have an out-of-pocket portion that's taken care of by patients that helps augment what's not paid for by insurances. And then the other thing that I think is kind of an umbrella thing that our clinic focuses on is sort of all things anti-aging and longevity and some specialty services within that, including hormone therapies, IV therapies, men's and women's health, pain medicine, some weight loss, and aesthetics services as well. Next slide, please. Um, the expectations, I put this up here just because I wanted to talk a little bit about the fact that, whomever we end up working with as a resident or as a colleague, we really do have high expectations for those folks' work and their output as a doctor. We have found that we match best with residents that feel like they're really ready to hit the ground running and ready to kind of take off on their career and want the guidance to help focus their direction in that way. It's a 5-day work week. There is significant patient context throughout the process. There's a lot of collaboration, communication, with the other physicians in our clinic, and we highly encourage people to apply that really like taking initiative and are sort of self-starters. Those folks work great with us. Next slide, please. In terms of compensation, our goal is to provide a premium compensation for our residents. We really want to attract the highest quality applicants, and we're willing to provide the highest quality compensation for that. You can read it on the slide, but if anyone has any specific questions about compensation, I'm very, very happy to answer those or through email or whatnot. But I think it's important to be transparent about the things that we're offering. The total package is over $80,000 in value. So if you have questions about the residency, want to get in contact with us to apply, or want to become a preceptor, because we do tend to give some preference to people that we've seen before and know before, definitely reach out to us at the email that you see on that slide. And I very much appreciate your time. Thank you, you guys.
Thank you so much. Up next is Canby Clinic. Canby, are you ready?
Hi. Yes.
thank
Hi, Dr. Yanez. Thank you. Can you hear me okay? All right. Great to be here today with everyone. I first want to welcome the prospective residents. You have a bright future ahead of you, so it's nice to be here and showcase Canby Clinic. And I also wanted to congratulate you on getting to this point in your education. And thank you to the AANMC for hosting this event. Canby Clinic is a primary care naturopathic medical clinic in Canby, Oregon. We're a fairly rural community, about 40 minutes south of Portland. Next slide, please. Canby Clinic is also a direct primary care clinic, which means that patients pay a monthly fee for membership here at the clinic. We do not do any insurance billing for services that patients receive here at the clinic. We do focus on a full scope of naturopathic medicine and offer primary care, but really our intention is to form long-term relationships with patients here at the clinic, cultivating good health over time. We do utilize some advanced therapies, including IV therapy, ozone, and minor surgery, which the resident would be trained on those treatments as well over the course of their residency year. The team here at Canby Clinic is very driven. I'm quite proud of the team that we have here. Everyone works together. We have incredible synergy. They come with their whole heart and serve the patients in the community here in Canby. This is a general overview of the patients that we do serve. We work very hard. So the resident, the applicant should have a strong work ethic. They should be willing to work full-time, 40 hours a week at least, and be able to think on their feet. There's often, what you think of that you're going to see in a day and what actually happens in a day can be very different. So being able to be flexible and move with the schedule or move with the patient need at that time is really important. We do a lot of focus on prevention and treatment of the cause. These are some of the therapies that you'll be trained on over the course of the year. I've trained many residents, very familiar with the training program and excited to participate again in the 25-26 season. The Canby Clinic Residency does offer a $60,000 annual compensation package for the full-time work. We do offer also a competitive benefits package as well. For each applicant, I do understand there are some fees to apply for the residency through the AANMC, and Canby Clinic will, for each applicant that we receive, will reimburse $100. If you're invited for an in-person interview, we'll add another $100, so $200 reimbursement for your time and efforts in applying for the residency here at Canby Clinic. Thank you again for your time today. It's such a pleasure to be here.
Thank you, Dr. Walker.
Absolutely.
Next up, we have Integrative Naturopathic Medical Center.
Hi there. I hope you can hear me. My name is Dr. Alex Chan, and I'm proud to be one of the, we're actually up in Vancouver, Canada, so a bit of a unique opportunity. That being said, we have had both American as well as other nationalities, so don't feel that you need to be a Canadian citizen in order to apply to our residency. Our residency program was actually the first in Vancouver and actually the first one in British Columbia. Started over 12 years ago when I was actually graduating myself. The clinic has been around for over 30 years. Started by 3 at the time. They were chiropractic doctors, but then since got naturopathic as well as acupuncture training. So there's a lot of diversity. It's a little bit different up in British Columbia in terms of scope of practice. We are technically primary care physicians, but because there is a larger public healthcare system, we tend to see more truly naturopathic care that we can provide, and we don't have referral rights to specialists. So that does change some of the ways in which you will be practicing. Next slide, please. What we do see, though, is that you'll have great opportunities for immediate hands-on access to patients right off the bat. So in addition to preceptoring with a variety of the doctors, we actually have 10 doctors in our clinics. We are a large healthcare facility, 9 naturopathic doctors currently, and 1 doctor of traditional Chinese medicine. You'll have opportunities to work with many of the doctors, so you'll see a variety of different practice styles, as well as different patient bases. We have some doctors that work predominantly with women, children, fertility medicine, as well as others that do more sports and regenerative injection therapy. So lots of practice experience. We also will start our residents training in our lab doing a full diagnostics as well as IV therapies. And we actually are the first in BC to introduce EBU, so a specialized type of ozone therapy recently as well. And like I said, we've got good opportunity for preceptoring for injection therapies, both prolotherapy, PRP, and we have a partner clinic that we have been referring to in Mexico that has a stem cell opportunity as well. So a wide range of different modalities there. We also do applied kinesiology, as a lot of the founding partners had that as part of their practice subset. So if that is something that you are interested in learning, we are a great place to learn that as well. And it's going to be a blend of both that patient experience and exposure, lab technician responsibilities, as well as working with our general manager, doing some of the business and different projects. So we think that it's important whether you end up afterwards. We generally have a 2-year residency. It is a 1-year with a 2nd-year opportunity, but we also have had many of our residents stay on with us after they are completed their residency in their own practice, but we want to set you up for success in future. So if that means that we need some business exposure as well, that's something that we like to provide and have certain projects like that for our residents to work on. And then there is a variety of different external externships and CE opportunities that we've given our past residents. Like I said, a lot of the doctors at our clinic have come directly out of our residency, so there's opportunity there. And a unique piece with us is that we have launched what's called the ICAP program. And so that's a lower income community access program that we've allowed our residents to be the lead physician on. So under supervision, it's a great way of building the practice. So not only will you have access to that wealth of patients, you'll also be getting new patient referrals. And we usually start private practice opportunities directly at the 6-month mark as well. Next slide, please. So just some I guess, images of our clinic and the variety of different techniques that we offer. And so if you have other questions, we are happy to answer. Both myself and our general manager, Carmen, are going to be available for questions. Please get in touch with the AANMC to get details on how to contact us. And we look forward to your application. Thanks for joining us today.
Thanks, Dr. Chen. Next up, we have Open Wellness. Oh, I'm sorry, Montana Whole Health.
Hi, good afternoon, everybody. My name is Dr. Gary Garcia. I'm the Director of Graduate and Community Medicine for Bastyr University. I'm pitch hitting here for Dr. Erica Crumbeck of Montana Whole Health. And this is one of the numerous Bastyr residency sites that are featured today. So just to talk a little bit about Montana Whole Health, this is actually a residency that is focused on pediatrics, infertility, and family medicine. It's a 2-year program. It offers a very competitive salary, and Dr. Erica did actually send me some additional information in her residency description. She did mention that the first year salary is 60,000 per year, plus an additional 450 allowance for health insurance, and second year salary is 68,000 plus health insurance. And of course, there are additional benefits as highly recommended by the CNE, which include 7 days of paid time off, 7 days of federal holiday, plus additional things that you see on this slide. So I think it's very competitive. Now, the clinic itself is located at the Community Medical Center campus. It's right next to Fort Missoula Park, which is really good. Always nice to have a place close by to just have a nice walk to decompress after a hectic day. As you can see, the resident will be focusing primarily on primary care with a specialty on patients of all ages. And this is true because the recent resident that graduated here, I was monitoring her patient contacts. It really ranged from newborns all the way up to the geriatric age group. So they do see a ton of patients, and the resident was always very busy. You can see the office hours here from 8 to 5:30. And yes, expect to see about 50% 18 and below, and about 50% adults. Usually the residents are the ones that see a lot of the adult patients as well, mostly acutes. And yeah, you're going to be a very busy resident in this program. These are just some additional information regarding what the resident is expected to do, which includes perform wellness exams and routine gynae exams. Some of the administrative responsibilities include keeping track of vaccinations and patient follow-ups, etc. As you can see, you'll also be seeing most of the acutes here are mostly infectious diseases, but you'll also get an opportunity to see some chronic conditions from failure to thrive, behavioral health issues such as ADHD and anxiety. And of course, as an applicant, it's really good if you have a strong foundation on pediatrics and women's health, because these are primarily the patient ages that and patient types of demographics that you'll be seeing. If you have any questions, feel free to email Dr. Erica. And as you can, there's her email right there, Erica at MWT that's mtwholehealth.com. So that's Dr. Erica at Montana Whole Health. Yeah, if you have any questions, just feel free to connect with her.
Thanks, Dr. Garcia.
Thank you.
Thank you.
Hi. I am Dr. Lana Gurvich from Open Wellness. I'm actually here also on behalf of my business partner, Dr. David Chang. We offer a 2-year residency. Like others, it's a 1-year mandatory, 2-year optional, but highly encouraged residency. My residency is focused in gastroenterology, and Dr. Chang's residency is focused in orthopedics. And so for both the residencies, about 50% of your residency is going to be highly specialized. I teach you how to navigate treating GI conditions, and he teaches you orthopedics and injections. Then about a third of the remaining 50% is going to be primary care, a third endocrinology, and for mine, the last third is women's health. He does a lot more male health. Next slide. When you work with me, you're working in a team setting. When you work with either of us, you're working in a team setting. There's always a first year and a second year resident that's on site. And then every week, I really prioritize case discussions and clinical case presentation. And so we spend a lot of time educating you, especially in your first year, on how to be a really, really skilled naturopathic physician. I've been at this for almost 2 decades. He's been at this shorter than I have. And we both offer both internal and external rotations during the residency. You know, I view really view my job as you're attending as to help you embody and understand the true power of the medicine we offer people. And then at the end of the residency, at the end of the second year, you have a very, very full practice where the minute you're done with your residency, you are immediately you feel very confident being a doctor, you immediately have a full patient load, and those patients go with you wherever you want. The priority really is the first year, I'm teaching you how to be a doctor and how to think like a naturopath. And the second year, I'm teaching you how to be a business owner, because the majority of us, after we're done with residency, are going to go into a business environment. And so the second year is really geared towards addressing that strategy to make you more successful. Next slide. At the end of the residency, you will have a complete patient load. You will immediately be able to start on your feet no matter where you go. We do not believe in non-compete clauses, and I have been in contact with all of my many years of residence going forward. The first year is all about building the skills. You don't have to worry about making mistakes because you're on my dime with my time. The second year is all about optimizing your business skills and how to really launch your business so you're successful for the rest of your professional career. And really, you're so successful, you really don't have another option of doing anything different. I help you grow based on my own knowledge of doing this for 2 decades. And then we support you in becoming the provider that it is that you want to become. Next slide. We do have a preferential for dual degree residents. Both Dr. Chang and I are naturopaths and licensed acupuncturists, and it's easiest for us to guide people who have our same degrees. We also have in the past had ND standalones, and then we also look at NDDCs or ND-LMTs. It's nice to have some kind of physical medicine modality just to help build a practice a little faster. Next slide. If you guys are interested in the residency, please reach out to us. We do also offer preferential treatment to anybody who's observed with us, who we get to know to make sure they fit our personalities and they fit our clinic. And it also is a multidisciplinary clinic with chiro on site, PT on site, naturopathic on site, and then a women's health nurse practitioner. Okay, thanks so much. I look forward to hearing from you.
Thank you, Dr. Gurevich. Rebel Med.
Hi, my name is Dr. Andrew Simon. I'm a naturopathic physician practicing now for about 11 years here in Ballard, Seattle, Washington. We've traditionally offered residencies either 1 or 2 years. We have in the past offered a naturopathic acupuncture residency for those dual track individuals. We are, going to the next slide, please. We are essentially a private practice, husband and wife owned. Here is my partner, Fonse. She's an acupuncturist. We've developed a clinic that really centers on a mind-body medicine approach to integrative care. We do this through my fact that I am a biofeedback practitioner. We use a lot of the principles of behavioral medicine, a biopsychosocial model, while at the same time offering a diverse set of therapies for really a little bit of everything. Musculoskeletal medicine, IV therapy. We can go to the next slide. Whether it's adjunctive primary care, our clinic team, myself here, as well as my partner. We also have typically multiple other naturopathic physicians, and other than myself, to aid in supervision. I myself was a resident at Bastyr. I continue to teach at Bastyr as adjunct faculty, where I teach the coding and billing and the business courses. So during the course of time, many of our residents have gone on anywhere from usually average of 2+ years at our office, some as long as 4 years before they go out and start their own practice. Many of our physicians have also won the Seattle Top Doctor Award at our office. This has aided their professional development. We've had doctors go on and work at the Seattle Indian Health Board, go start their own private practices, and we really try to encourage that professional development and business development, along with networking. As I was speaking to, we are a kind of a hybrid model. We, much like some other clinics in the greater Seattle area, we do try to emphasize both the accessibility to our patients through insurance, but also a lot of the functional medicine and integrative non-covered services that are out there in our field of medicine. So it gives our providers a full freedom of being able to provide these services. We offer, like I said, physical medicine modalities. I do a lot of musculoskeletal work, OMT, trigger point injections. We offer IV nutrient therapy. In the last 3 years, we've started to move into more of the natural aesthetics, including radiofrequency microneedling, non-ablative laser therapies, and various body sculpting techniques with like the M Sculpt Neo, for example. I really emphasize this component philosophically in our care. In every annual exam that we work with our clients, we really focus on, the mental health aspect of care, the biopsychosocial model. And so what our patients really appreciate is, providing that safe place for their care in a kind of a tumultuous world at times. And, this is one of the reasons, we've pivoted to lots of different things in the past. We had to do COVID testing, COVID vaccines. And again, in those examples, patients came to us because they really valued our, time that we take with our clients, and doing it in a safe, kind of informative model. So over the years, like I said, we've now consistently won, the Top Doctor Award for 8 years in a row. We try to really encourage that business networking with local PTs, chiros, MDs, mental health providers. And our goals that we have set is that we try to get this award for every doctor that comes to our office. And we encourage, that through the networking locally in the various care practitioners in the greater Ballard area. So we do work as a collaborative team. A lot of our clients will see multiple patients will see multiple providers at our office. We really do find that this one-stop shop approach really has aided care availability and at the same time as a small practice. We do have 8 treatment rooms, like I said, multiple different services. So we try to create a lot of flexibility for our clients. General outline of what a residency might look like. We really do encourage that shadowing and hands-on, learning systems, assisting with procedures, making sure that you feel really safe and comfortable in that process. We then start to see, after credentialing sets in, opportunities to have some direct solo time with clients. Again, case management, case review. And at that time, you really emphasize this coding and billing and this new model of hybrid care that we offer in terms of both being able to bill insurance as well as understanding what is a non-covered service. And then that slowly grows to the capability of seeing more and more clients as you start to build your practice and you work on your marketing. And over time, we start doing more, the billing assessments to make sure that we're really hitting our marks and to help you in the growth of business and practice potentially going into your second year. So we do have core responsibilities in making sure that you're assisting the providers on hand. This helps allow you to build that understanding of that difference between school and private practice. We do encourage you to get out into the field and network to build your brand, really, to let people know who you are as you work with other nurse practitioners, MDs, and the allied health profession. We're always continually, working on new business models and all those things for care. So I want to make sure I have enough time for everybody else. So we'll wrap up here. And if you have any questions, I'll put the information in the chat and we'll go from there. All right. We really appreciate your time. Thank you very much.
Thanks, Dr. Simon. SageMED, you're up next.
Hello, everyone. Welcome and thank you for coming to this. This is a big step in the whole process for you. My name's Dr. Mickey Bronner. I am a second-year resident at SageMED. You can go ahead and go to the next slide for me. So what we're basically looking for and what Dr. Wheeler's wanting when you come into the program, he basically wants someone that knows where you want to go, that you have some sort of a dream that he can help you get to, and he's really good at doing that. So with all of that in mind, you spend a lot of time first year shadowing Dr. Wheeler, honing in on primary care skills, learning a lot about hormones and injection therapy, as well as the business and techniques that you don't learn in school. It is very good pay for the program. We'll get to that at a later slide here, but there are roughly 14 doctors in the clinic, including a medical doctor, a nurse practitioner that you get to learn from. So there's a lot of opportunities to shadow and really hone in on skills and figure out where you want to go as a doctor. Motivation at the clinic is really just to make better doctors so that we can serve the community better and help drive opportunities for NDs in the future. All right, so hormone therapy. So working under Dr. Wheeler, you essentially become kind of a specialist in hormones. You deal with a lot of hormones in various formats and help people to optimize those hormones. We do a lot of injection therapy, including PRP and stem cell, all ultrasound guided. And there's a couple of people in the clinic that do a really good job that you get to learn from. We also have a huge aesthetics program with a lot of really nice machines that Dr. Wheeler likes to invest in. It's probably why I don't look as old as I am, is because of all the aesthetics, which is nice. But it's a very integrative team. We have currently 9 NDs, 1 nurse practitioner, a medical doctor, an acupuncturist, 2 doctors of physical therapy, 4 counselors, a phlebotomy on site. It's just a very well organized and very well run integrative clinic. There's a lot of business mentoring, and Dr. Wheeler will help you with what your interests are to model a business that works for you. All right, so first year, 54,000 salary. You get a stipend for healthcare, CEU credits, which Dr. Wheeler a lot of times pays more than what he actually says he's going to. 56,000 annual salary in the second year, but the big one is you get a 10% bonus every quarter based on the money you're bringing in after expenses. To give you an idea, in terms of second year, you have all high level of autonomy. I saw last quarter, I think 650 patients. So it's very, very fast, high paced, and yeah, you learn a lot. That's it. I think that's it. Thanks, everyone.
Thank you so much, Sedona Wellness Retreat.
All right. Thank you, Joanne.
Hi, long time no see, Ryan.
Yeah, doing good. Hopefully you're well.
Yeah, love to hear about your center.
Perfect. Well, my name is Dr. Ryan Furchoff, and I am the medical director here at Sedona Wellness Retreat in Arizona. We are an inpatient facility that houses up to 14 patients where they stay with us for a couple of weeks to a couple of months. Our focus at the retreat is primarily taking care of patients that have cancer, but we welcome others that have acute and chronic conditions such as Lyme, autoimmune, diabetes, as well as those just looking for better health. We offer a number of programs here at the retreat, and such as juice fasting, water fasting, and then our advanced cancer programs as well. So here, especially for the therapies and treatments, we actually work out of this facility. It is a yurt. And here we offer a number of different therapies to help one's body with better rhythm and balance and kind of instill that natural vitality with them through the hyperbaric medicine, fever, hyperthermia, ozone saunas, acupuncture, craniosacral therapy, and a lot of different IV therapies such as high-dose vitamin C and alpha-lipoic acid, curcumin, NAD. We do EBU, different ozone and ultraviolet light therapies, as well as mistletoe therapy. This experience is an intensive learning and educational experience where we utilize a lot of the different naturopathic modalities and treatments and care all in one place. From past doctors that have worked with us, I think that's what is really nice about these residencies is it really helps put that skill, that knowledge, all that training and ability into these new residents to get them, let's say 10, 15 years ahead of those that just kind of go out and do it themselves. So that's the nice benefit of being in a residency. We also here too, we also see advanced cases, especially a lot of these cancer patients that come and see us. So we see these advanced cases here, and also being in a retreat center, a more intense environment, which allows us to go deeper and more intense with the patients in their healing journey. So as a resident, here we'll sharpen your skills, your clinical skills and therapeutic skills. Will help to build your confidence and ability to take care of advanced conditions. We will put your knowledge and skill to the test to take naturopathic medicine to the core, being doctor as teacher, treating the whole person and using the healing power of nature. So if you're looking for, a challenge, put your skills to the test and see what naturopathic medicine can do, then, please consider here, the residency here at Sedona Wellness Retreat to take on your next level in training. And I hope to hear from you soon. Thank you.
Thank you so much, Dr. Furchoff. Next up, we have Stark, please.
Hi, my name is Dr. Alice Nguyen. I've been in practice for 8 years and have been at Stark for 8 years as well, although Stark as an institution has existed for over 13 years, I think actually close to 15 years at this particular point. We have 3 locations, brick and mortar locations in California. So Newport Beach, Tustin, and the West Hollywood / Beverly Hills location. So our mission is to change the future of health and fitness in the communities in which we serve. So it is 360 degrees integrated healthcare. So we have naturopathic concierge care. We have health coaching and nutrition. And actually that's really kind of integrated with the naturopathic kind of education there too. We have a team of chiropractors and mobility specialists and a team of strength coaches basically carrying out the exercise programs. So all members of the care team actually collaborate closely. This is not a siloed sort of, situation where everyone lives in their own department. We all contribute to that patient who's coming into the center together and come up with the best plan possible for that particular individual. So the conditions that we treat is number 1 is actually cardiometabolic. So we do see a lot of that. Our patient population is, I think I mentioned it in the slide, but we do see C-level executives and their families. So a lot of these patients have spent decades kind of abusing their bodies, and they come to us because they want to live longer, like a healthier life as well, and increase their health span, not just their lifespan. We do see some autoimmune, definitely men and women's health. This is a somewhat unusual practice because we do see about 60% men and 40% women. GI, MSK, that's actually more on the chiro side. We definitely treat a lot of respiratory infections in the past 4 or 5 years. And very rarely will we actually come across mold toxicity and heavy metals. So that's kind of line listed as the priorities there. The modalities are listed there. We do a lot of biotracking. We actually have a DEXA scan on site for our West Hollywood as well as our Tustin location for body composition, infrared saunas, and yes, we do prescribe certain pharmaceuticals as well. And comprehensive labs, that's definitely something that we do at Stark. So patient populations primarily between 35 to 65. Actually, our oldest patient is in fact 83 years old. So that's kind of a rarity. We do see professional athletes and as well as, of course, gym novices. And it's about, again, that 64, 36% distribution for gender. So the ancillary benefits at Stark, the cash retail value, actually, I believe it's more now. It's actually around $30,000 that the resident will actually be receiving. So this includes personal training, chiropractic and a soft tissue mobility, personalized nutrition plan, and you will be actually seen if you're open to it, you'll be seen by our senior NMDs. Health, dental, and vision is covered, 401k matching after 1 year. And the idea is that we actually want to hire for longevity. So a lot goes into the training specifically at our practice, and it's a very specific type of practice. So we're finding the best applicant. We're investing a lot into their education with the intention of keeping them for as long as possible. So we do have some employees, not doctors, who've been with the company for, I believe, over 10 years. So this is we hire for longevity. The salary is actually at $68K starting next year in 2025. And that's actually all for me. One more thing. We do require preceptorship, 40 hours at a minimum. So we will not grant an interview to any applicant if they have not preceptored with our practice. So thank you.
Thank you so much for sharing that. And I know the resident applicants really do appreciate all of the transparency and what the expectations are for successful applications. So thank you for sharing that. We've got Yellowstone Naturopathic Clinic up. Dr. Beeson.
Hello. First of all, I want to reiterate Dr. Canby's congratulations to you all for residents for being in your potential residents for being in your second semester getting ready to go for graduation. And also, I'm absolutely impressed with all of the clinics. I've been practicing, and the Yellowstone Naturopathic Clinic has been in Billings, Montana for 32 years now. So we have patients all the way from a month to over 100. We do have two residencies. We have the general residency, and you will receive mentoring by myself with a chart review every week, but also with every patient. I have you check in with me because you will start seeing patients after your orientation of 2 weeks. To also have rotations in the community with different specialty clinics and vein clinics and laboratories, et cetera, et cetera. I'll take the next slide, please. Then we also have the a unique residency in that the residents spend part-time at the Cancer Center associated with St. Vincent's Hospital and also see patients at YMC in general practice. And the oncology residency at St. Vincent's has been in a place for 18 years. So the residents over there attend tumor board once a week and work with the with the physicians, hematologists, oncologists over at the Cancer Center. And also we have they travel to Miles City, or currently we're doing that just remotely to see patients. That's about a 2.5 hour. They have a cancer center down there, and that's more of a residential, serves all of eastern Montana. And we do have a quite a large medicinary with tinctures, et cetera, all the proper substances that you will have access to, and a full support staff, including a medical assistant. We do have IVs. We have been doing regenerative injection therapy at our clinic for 28 years since Prolo first started. And we do the PRP, and we're not allowed to say STEM because of the FDA, but we are doing a new type of product that was called STEM. It's called cellular tissue matrix now, which is quite amazing. We have gotten great results. We're very specific with helping people decide which of those treatments are the most specific for them. We have a chiropractor. We look at their radiology reports and do physical exam to help them identify which treatments are the most useful. Our residency is a 2-year obligation, and we are very, very specific about your training and about core naturopathic care, treating the underlying cause. And as I mentioned, we have a quite a robust relationship with the conventional medical community. Billings is a medical center for all of eastern Montana, probably central to eastern Montana. So we have patients coming to us from all over Montana and Wyoming, and they know us well because, again, we've been in Billings for 32 years. We do invite people to come and spend time, make sure that it's a good fit for you, and we are very excited for furthering the goals of having primary care and core naturopathic medicine that we offer to residents learning at our clinic.
Thanks, Dr.
Might be doing good slides. Yeah. Is that the end of the slides?
That is, yes.
All right, great.
Thank you so much. Sonoran University, Dr. Vasquez, please.
Thank you, Dr. Yanis. I am Dr. Joseph Vasquez. I am the Associate Dean of Clinical Education at Sonoran University, and I'm currently serving in the role of Interim Residency Director until that position is filled, though the entire program does report up to me. So today I want to talk about the opportunities that the university has in regard to our residency programs. So first and foremost, I want to take the opportunity to clarify the difference between our institutional and affiliated residencies. Some of you may know that our affiliated sites, those private practices, must be affiliated with an institution within the AANMC, such as Bastyr, NUNM, CCNM, and Sonoran University. Today, we're going to be talking about our institutional residencies, the residencies that we offer on site within the university. However, I do want to take this time to talk about our Sonoran Residency Network. What is unique about our residency system is that we do have a network of shared resources. What that means is those who are matched with an affiliated residency site with Sonoran, we'll still have access to university resources, such as library resources, up to date, and so forth. We also collaborate quite often. With this year, we are looking at the start of grand rounds where all residents, whether it's a Sonoran affiliated or institutional resident, will be participating in quarterly grand rounds that are presented to the community at large. There's also opportunity for offsite rotations where a Sonoran institutional resident would have the opportunity to go to an affiliated resident site as well. So as I mentioned, we're going to be talking about our institutional residencies today, of which we have 3 and 2 in the first year. The first year residencies are our general medicine and regenerative medicine residencies. The regenerative medicine residency focuses on non-opioid approaches to pain, such as PRP, Prolo, injection-based therapies. Our general medicine is a little more comprehensive, focusing on primary care medicine and the large scope as it applies in the state of Arizona. Our second year, we do offer some general medicine second year residencies. The regenerative medicine track is a 2-year track, and we also offer a second year homeopathy residency as well. So regardless of the year that you are in and the program in which you are enrolled within our residency program, the experience is quite the same. You're working directly with physicians overseeing patient care on a combination of either student shifts, which you are all experiencing right now, or private practice settings. You're going to be meeting weekly with the residency director to go over logistics, healthy check-in, but also to review didactic exercises, whether it's reviewing cases or hearing from guest speakers in various fields. You're also going to be working with students supporting their clinical skills in multiple settings, both in the classroom and within the clinic setting as well. And that really leads to us having a set curriculum. So we have a standardized curriculum that is based on essentially who we're able to pull in regards to expertise speakers. Next slide, please. So in the standardized curriculum, we tend to focus on certain topics like cardiology, neurology, and so forth, and bring in those guest speakers so that we have a standardized representation of what you would be seeing in general primary care practice. And we have this breakout. Again, the breakdown is distributed across our 4-quarter system, where in your year of residency, whether it's first or second year, you're getting that same experience and exposure to expertise in a various amount of fields. Projected workload. This is really important in regard to what is the expectation of an institutional resident, and really the large difference between a private practice affiliated site and an institutional site is that you will be working with students quite often. And so those applicants who are really motivated to have some kind of instructional background as well would fare very well within our institutional residency. Next slide. And as you can see,
we're just about at time.
Okay. So
Thanks.
as you can see, we're looking at about a 50-hour work week, but I do want to close in noting that Sonoran University, you'll have access to these slides, of course, but Sonoran University being a university setting, you will have access to a lot of additional opportunities, including research, didactic instruction, which these are all extra contracted work. But if you have more questions, please feel free to contact me. My contact is in the slides as well. Thank you all for your consideration here and supporting residencies in naturopathic medicine.
Thank you so much. So we have, and these will be disseminated as well, lots of places where you can find information as well as recordings. Next slide. And so the next for you all that is probably important to remember is the phase 2 Q&A session, which is on January 26th. So please do put that in your calendar and register now. And now we're going to move to Q&A. We don't have a ton of time for questions. There was one question that came in. If all of the sites would be able to type up an answer and place it in the chat for everyone to see. The question is as follows. Can you provide a sample schedule, including shadow time versus time seeing patients on your own, and that the responsibilities? I think they're trying to get a sense of which sites do you see you're on your own very early versus are you spending more time shadowing and for how much time? So if you'd be able to, because I know we don't have time for every site for me to call on you all, but if you could place that in the chat, that's from Erica. I think that would be really helpful. And then there is an insurance question regarding, does the insurance compensation generally cover dependents? Dr. Garcia, would you be able to take this?
Well, for Bastyr University, it does. I can only answer for the university. Maybe some of the affiliate sites that are on the call today might be able to provide some additional information on that as well. But for Bastyr, yes, it'll cover the dependents, but of course, there's going to be a change in your premiums.
Sure. Does anyone else want to jump in on that question regarding healthcare covering dependents?
SageMED does not.
Okay, thanks, Dr. Bronner. Yeah, I think that would be a question to pose to each of the sites, most likely, because they're independent sites. They're going to have their own structures for healthcare. Currently, the CNME guidelines only require that the healthcare or the benefits are provided for the resident themselves. Well, with that, thank you all for coming. I hope that this was an informative day for you and that you learned a little bit more than you came into the webinar with. And I wish you all the best of luck in this process. I know that it can be a little daunting and, just trying to keep all of these decisions straight for you to make the best choice for your career. But what I want to end on is the immense value of completing naturopathic residencies and the amount of confidence that you get in your clinical care. Many of the residency sites talked about helping you as a new doctor land well with your business skills, your patient recruitment skills, your patient retention skills, all of the things that you're going to need to feel confident in going on to the next phase and being super successful. So with that, I thank you all for spending a little bit of time on a Saturday with us, and I wish you all the best luck in your path. Thanks all so much for coming.